Chapter 9, Obstetrics and Neonatology. Surgical terms, amniotomy. Otomy is incision into, and amnio is amnion. Episiotomy, again, incision into, in this case, the vulva. Cervical cerclage. This is a procedure where the cervix is sutured closed in order to prevent it from continuing to dilate and producing a premature delivery. Cesarean section, commonly referred to as a C-section or in writing as CS. This is where birth of the fetus is through an incision into the mother's abdomen and uterus. And in vitro fertilization is a method where an egg is fertilized outside the body, and then once fertilized is placed into the uterus and to attain pregnancy, and these are typically done as a part of an infertility process. You're looking at some more terms, and these are again both built from word parts and not built from word parts. Amniocentesis. In this case, this is one that is built from word parts. Centesis, we know, is surgical puncture to aspirate, and amnio is amniotic fluid, so that's surgical puncture to aspirate amniotic fluid. APGAR score. This is a scoring process where immediately after birth, they can get a very rapid assessment of how the fetus is. And it measures their heart rate, the respiration, their muscle tone, the response to stimulus, and their color. And they are all given a 0 to 2 scoring. And the overall score then becomes 0 to 10 for all 5 parts of it. These are tested at 1 minute and 5 minutes after birth, so they're scored twice. The APGAR comes from the person who developed the process, which was Virginia APGAR, and so this is a very quick. This is done on all newborns immediately after delivery. Chorionic villus sampling is a prenatal test that takes a sample of blood from the placenta through the abdominal wall. Typically, they're done about 10 to 13 weeks of gestation, and the reason is looking for chromosomal or genetic problems and the likelihood of those. Nuchal translucency screening. In this case, it's an ultrasound test looking at the back of the fetal neck, and they're looking for thickening of the neck or for extra fluid there. And this is done between 11 and 13 weeks of pregnancy, and they're looking here for the potential risk of Down syndrome as a disorder. Pelvic sonography. This is obtaining a recording, or process of recording by sound waves of the pelvis. So this would be built from word parts. Pelvic is pertaining to the pelvis. Process of recording is with the use of sound is the sonography. Quad screen is a blood test done during the second trimester or the middle of pregnancy, looking at 4 different hormone levels. And with the use of those, there is a general outlook of whether this fetus will have a particular type of disorder, such as Down syndrome or neural tube defects or those kind of things. In the second part of the chapter, we will define, pronounce, and spell complementary terms and look at the abbreviations and do some clinical applications of the terminology. Some complementary terms, and these are actually all built from word parts. Amniorrhea. Urea refers to discharge, and amnio refers to amniotic fluid. So this is a discharge of amniotic fluid. Multipara or multip means many births, para means births, and multi means much or many. And so this is a female who has had a larger than average number of births, or at least a large number of births. Nullipara, in this case, this para again refers to births. Nulli means no. So this is no births. This is a female who has not given birth at all. Prima gravida. Um, prima means first, and gravida means pregnancy. So this is a first pregnancy. Puerperal means pertaining to AL, and this is pertaining to childbirth is the first part of the word, and this is referring to immediately after that birth. Just an explanation of the gravida and para and how you might see it actually written in an actual document. A 27-year-old G4P2113 is a woman who has had 4 pregnancies, 2 term births, 1 preterm birth, 1 abortion, and has 3 living children. Examples of terms not built from word parts in complementary section are cephalic presentation. In this case, it is a birth position where any part of the head is coming out first, and it is actually a common and preferred presentation. Colostrum is thin, milky fluid secreted from the breast during pregnancy and during the first days after birth, before they actually start producing milk. In vitro is outside the body or in a laboratory setting. Midwife is a person who practices midwifery, and midwifery, it's not on your list, but it is a person who supervises during pregnancy, labor, delivery, and shortly following delivery. So it is someone who practices basically obstetrical care pretty much exclusively. Parturition, and this is the act of giving birth. Here's the term breech, and of course it's pronounced the same way, but it is 2 different spellings, and of course 2 very broadly different meanings. A breech presentation is birth where the buttocks, the feet, the knees come out first, and it's in the infant is referred to as a breech baby. Breech with an A instead of an E means failing to observe law, conduct, or agreement. So in this sense, this breach is a legal term. The other breach is a obstetrical presentation of the fetus term. Some neonatology or newborn complementary terms. Congenital anomaly. This is an abnormality that is present at birth. It might have been found prior to birth by ultrasound or by amniocentesis, but the point is it is an abnormality that is present when they're born. Meconium is the first stool movement of the stool or bowel movement of the newborn, and this is you want this, of course, to happen after birth and not prior to birth, which in abnormal situations can happen. A neonatologist is a physician who studies and treats disorders of the newborn. Stillborn is an infant that is born not living. This is an infant that either has died at birth or has died prior to birth. And if it is up to or after 20 weeks, it's stillborn. If it is it has died at birth or died when it's born, then that would also be a stillbirth or stillborn. Tetranogen is any agent that produces malformation in the developing embryo. So anything that can cause malformations in the embryo would be a tetragen. Okay, abbreviations in this chapter, and this is only a few of them, but FAS is fetal alcohol syndrome, and we have found this as an increasing number in pregnancies over the last several years. LMP is last menstrual period. This is used early on, especially in support of trying to determine the date of delivery or the date of arrival of the infant. PREMIP is primipara. RDS means respiratory distress syndrome, and VBAC, and you may hear it referred to as VBAC, that is vaginal birth after cesarean section. And again, at the end of the chapter, we're going to look at pronouncing some of the terminologies in the chapter in a clinical document. I would encourage you to try to pronounce these as we go through them so you can help you in developing your language pronunciation. Josephine Alcotts is a 34-year-old gravida 2 para 1 woman. Her LMP was April the 20th, 20,000 XX. The EDD, or estimated date of delivery, is January the 25th, 20 XX. The obstetrician prescribed folic acid to prevent spina bifida. The patient's first pregnancy was complicated by preeclampsia and a breech presentation, which required a cesarean section. Pelvic sonography showed a single female fetus with normal development. She went on to deliver a healthy baby by VBAC 3 days before her expected delivery date.